Okay, so we just completed the top 100 and 101 through 200 RX drugs. So now we're going to do a brief run through of the classifications of those drugs. So first we have the ACE inhibitors. ACE is angiotensin converting enzyme inhibitors. They block the conversion of angiotensin 1 to angiotensin 2. Avoiding angiotensin 2 may avoid increased blood pressure and vasoconstriction. They usually have the suffix pril, which is PRIL. Then we have A2RB, which are angiotensin 2 receptor blockers. They block angiotensin 2 enzymes from specific receptor sites. Avoiding angiotensin 2 activity helps prohibit vasoconstriction, and these usually have the suffix artan, which is ARTAN. Next we have antibiotics. Antibiotics inhibit the reproduction of new bacteria cells. There are several varieties and drug class definitions of antibiotics. Then we have anticonvulsants. Anticonvulsants suppress the rapid firing of neurons in the nervous system. They're also known as anti-epileptic drugs and anti-seizure drugs. Antidiabetic / sulfonylureas. They lower glucose levels in the blood. They are only used to treat type 2 diabetes. Benzodiazepines, also known as benzos. Benzos are used as anti-anxiety agents, muscle relaxants, sedatives, and hypnotics. They usually have the suffix PAN, P-A-N. Beta blockers, B1, also known as beta-adrenergic blocking agents. They block adrenaline receptors, which are part of the central nervous system and mediate a fight-or-flight response, which would cause actions in the heart. They usually have the suffix OLOL, OLOL. Calcium channel blockers. These work by blocking calcium channels in cardiac muscle and blood vessels, thereby slowing down activity in the heart. Diuretics are primarily used to treat hypertension. They promote evacuation of water from the body, which decreases the load on the cardiovascular system. HMG-CoA reductase inhibitors. These are also known as statins. They inhibit the body's cholesterol production and usually have the suffix statin, S-T-A-T-I-N. NSAIDs, which is non-steroidal anti-inflammatory drugs. These are commonly used as painkillers and fever reducers. They are non-narcotic and can be sold over the counter. Opioids. These provide an analgesic effect by decreasing the perception of pain and increase pain tolerance. Proton pump inhibitors. These inhibit the action of the gastric proton pump, thereby reducing gastric acid production. They usually have the suffix prazole, P-R-A-Z-O-L-E. SSRI are selective serotonin reuptake inhibitors. These increase the body's serotonin level by inhibiting its reuptake into the presynaptic cell, commonly indicated as antidepressants. And that is a little bit about the drug class definitions.